Madam Speaker, I feel like I have a pre-existing condition. It's arguing about the Affordable Care Act. For 10 years, we've argued about the Affordable Care Act. A campaign is part of forming a government. And no issue resonated with the American people in the last election like the issue of pre-existing condition. My friend, the gentleman from California, previously said he didn't understand why people had to buy something that they didn't want. Well, we require people to buy automobile insurance, and by the way, you don't buy automobile insurance the day after you've been in an automobile accident. And we probably don't want to buy homeowners insurance, but guess what? We don't buy it the day after your house is burned down. We buy it because the genius of insurance is the spreading of risk. So I ask the following rhetorical question, and that is, why should the rest of us annually put $1,000 into our premiums for health insurance to take care of those who don't want to buy health insurance? So what this discussion and argument is really about for the moment is the following. The child who is born with diabetes is then told under the old system that they can never buy health insurance, or if they do, it has to be rated. Back to the old actuarial argument about how do we spread risk. The protections that were built into the Affordable Care Act, which I helped to write, were based upon the idea of using the best principles of the marketplace while simultaneously using the ability of the federal government to prod certain behaviors, and those behaviors included a ban on pre-existing condition as an option for people who didn't want to buy health insurance. So what did the other side do? They filed a lawsuit. Now, they generally lecture us on activist judges. They decided that they would challenge what has become okay with the American people, the Affordable Care Act. They would challenge it in the federal courts and really didn't want to bring down the entire Affordable Care Act. Instead, they wanted to disassemble piece by piece parts of the Affordable Care Act that really, in a lot of ways, have made for success. There is no arguing with the following statistic, that today, between 17 and 20 million Americans have health insurance that didn't have it before the Affordable Care Act. And back to those people who, by the way, their system of health care was the emergency room. So in the emergency room, we all know it's a pretty poor way to get health insurance because it really doesn't emphasize preventive care. So all of these options that we built into the Affordable Care Act, including making sure that people that had pre-existing condition couldn't be exploited in the marketplace with undue costs. This argument that we continue to have, Madam Speaker, here about the Affordable Care Act could be rectified in short order by both sides just working together to improve the Affordable Care Act, and I yield back the balance of my time.